Today we're joined by Dr. Gideon Smith. Gideon Smith has just won Dentist of the Year for the Sensodyne brand, and this is all for her care of autistic patients. Thanks very much for talking to us today, Gideon. So tell us a little bit about why you won Dentist of the Year and how you came about getting nominated.
Well, the patient who nominated me is called Neil, and Neil is 28, he's autistic and very nervous in the dentist. So Neil had quite bad periodontal disease, that means gum disease, and he was looking at a general anaesthetic for treatment. And as you know, a general anaesthetic and a hospital admission is quite traumatic for someone with autism. It's a little too scary. So his mum started looking for other options, and she came to us, and we offered him the option of doing the treatment in a number of visits with nitrous oxide sedation. So nitrous oxide is the gas and air sedation. You breathe it in through your nose and it makes you feel really relaxed. So we treated Neil over a number of stages and got his gums healthy and got him back to dentally fit, which is where he wanted to be. And over time Neil got so used to coming into us, we didn't need the sedation anymore, we don't need the gas and air anymore, and he comes into us now every 3 months for a cleaning. Because he finds it hard to clean his own teeth, as well as maybe a dentist might like. So we help him out by seeing him every 3 months for a cleaning.
And, you know, you can just even see in talking to you there the kind of care and attention and knowledge you have of autistic patients. But where a lot of our users would feel that, you know, there isn't that general understanding. And do you feel that there is a broad understanding of autism amongst the dental profession?
I think so. I think things are changing. In every profession, an understanding of people with a special need is changing. And I'd like to think dentistry is following that pattern. And the dentists are taking into account people with a special need, and everyone's different, and how you treat them has to be different accordingly. So we would take into account the fact that patients with autism find loud noises frightening, find a new environment, you know, a scary place to be. A dental surgery is very scary because there's lots of noises, there's lots of touching, there's lots of new people, you know, a new room with movable pieces of equipment, all that kind of thing. So you have to take that into account and work with each patient individually.
So what do you do to make your autistic patients feel more comfortable in your surgery? So kind of talk us through the typical visit maybe.
I suppose for an autistic patient, the most important thing is actually before the person even walks in the door. So we will talk to that patient themselves, or where appropriate, maybe their parent or their carer. And before they come in, we'll find out what things upset them. So what kind of noises, what sort of feelings. Some people hate the touch of metal. Some people hate the touch of cotton wool. So we'll find out all these kind of things from a parent. Some patients prefer to come into a room and become acclimatized before you even speak to them, before you even interact with that patient. So we'll talk to the family member, the carer, or as I said, that patient themselves, depending on their level of comprehension and understanding, and see how we can make their visit more comfortable. Some parents suggest things like a weighted blanket, you know, to make them feel more secure. Some patients want to bring a cuddly toy or something in with them, and that's never a problem. So we'll prepare for their visit in that way.
And obviously, I guess for every patient with autism, the goal would be to limit the number of visits. But, you know, an awful lot of our users, be them adults themselves or actually children with autism, they have great difficulty regards the maintenance of their teeth on a regular basis. You know, it can be a battle with the different senses and such. And what tips would you have kind of for ongoing dental care for people with autism?
I suppose what's really important is starting treatment early, starting care early, because when you have, for everybody, every single person in the community, seeing a dentist at least twice a year is really important. And even more so if you have a patient with special needs, where, as I was saying with Neil, it's difficult, the day-to-day is difficult. You know, brushing your teeth twice a day isn't easy. And so seeing a dentist every 6 months is even more important, or arguably even more important. So starting that routine early with children is where we really want to get to. Because if we can make it that coming into the dentist and seeing us every 6 months is just part of the course, then it becomes less scary. We do look at, you know, the initial visit where maybe we don't even get to look at the patient's teeth, and that's not a problem. It's just to meet us and see the practice and see what's involved, show them the mirror, and then maybe the next day they'll sit in the chair, and maybe it's even the third or fourth visit where they allow us to look in their mouth. It can be difficult with autism to predict what's going to happen and to understand that, and so to be able to see the surgery first and meet the team and know what to expect. is a big factor in helping people feel relaxed.
I think there's some really useful tips for everyone involved, be they autistic patients, their family members and dentists, and hopefully this will help an awful lot of people, and hopefully we can talk to you again soon. So thank you very much for your time. Thank you.